I want to thank everyone for joining us today. And I'm pretty sure there's going to be more people joining in today. But for those who do not know, my name is Eugene Gallego. I am the program coordinator for Good Health and Wellness. I assist with 18 tribal communities and 10 subawards within the Great Plains region. Today we'll be having our community health webinar on the economic impacts of commercial tobacco, and our presenter today is Tara Huska. I'll let Tara introduce herself here in a bit, but for those who are just now joining in, if you could please send your email through the chat box, and that way we can send the recording out as well as any informational material shared today with Tara. So if you could, please send your email through the chat. And also, would you please, for those who do not have their microphones muted, please mute your microphones. And I will now turn it over to Tara.
Hello, everybody. My name is Tara Huska. Can you guys hear me okay?
Yep, we can hear you fine.
Okay. So my name is Tara Huska. I'm a member of the Oglala Sioux Tribe. I'm the tobacco control health educator here at Great Plains. And we've had a lot of discussion and questions about the economic impacts of non-smoking policies, especially in tribal communities. So I had some help from some colleagues and people that emailed me information. So we put together a presentation. I think so. Okay, can everybody see my screen okay?
Yep.
Okay. Here we go. So the economic impacts of non-smoking policies. I had a difficult time finding information that was specific to tribal communities, but I found a lot of really good information nationwide. So there are a lot of smoke-free policies. There are not a lot of smoke-free reservations across the U.S., but there are a lot of policies. There's policies within tribal buildings, federal facilities, schools, but a lot of these policies aren't enforced. The tribes have a difficult time enforcing them, and the children, elders, and everyone else are exposed to secondhand and third-hand smoke. And those of you who aren't familiar with third-hand smoke is when somebody who is smoking goes and holds a child, the child can still inhale the carcinogens that are on the clothing of the person that was smoking. The tribes that I could find that had existing smoke-free reservations was the Cheyenne River Sioux Tribe and the Blackfeet Nation. There could be more that I couldn't find, but these are the ones that I found. Also, the Cherokee Nation, they don't have reservations, but all their tribal facilities are smoke-free. The American Lung Association estimated that the cost of a pack of cigarettes is $5.51, and I think this is the average. And the cost of those cigarettes for the economy is $18.05 per pack. Tobacco kills nearly 500,000 Americans annually, and cost the nation $333 billion per year in healthcare expenses and loss in productivity. So smoking costs a lot for even a smoker. They're averaging about $2,011, and that's at a rate of 1 pack a day. They're spending that much a year. And it fluctuates because every state is different. All the taxes are different by state. But this is kind of just like the average for the nation. On average, smokers will typically pay 15 to 20% higher premiums than non-smokers with equivalent demographics and health conditions. If the monthly premium for a non-smoker is $500 per month, it will be upwards of $600 for a smoker. There are quite a few different costs attributed to smoking. The four major ones that I have are the healthcare costs, higher insurance premiums, costs and deaths from smoking, and the loss of productivity. The healthcare costs are rising twice at the rate of inflation and wages, over $8,300 per employee in health insurance costs. The higher insurance premiums, life insurance is $90 more per smoker per year for a $75,000 life insurance policy. The fire hazard insurance is an additional 11 to 21 higher for each smoker in the household. According to CDC and SAMMEC, about 400,000 premature deaths per year from smoking, almost 50,000 from exposure to tobacco smoke. The lost productivity costs are at $96.8 billion per year, and this was back in 2001. I didn't find any new numbers on that, but and an additional billion from lost productivity among non-smokers are exposed to tobacco smoke. The loss in productivity and how they measure that is basically those who are missing work because of poor health due to smoking, and those taking smoke breaks. A lot of times people who are exposed to smoke or that do smoke, sometimes they smoke. I know me as a non-smoker, when I'm around people who do smoke, it really makes me tired and heavy feeling. So I feel less productive when I'm exposed to cigarette smoke. So I think that's a lot of where these numbers come from. And you can kind of see by this graph the estimated number of full-time and part-time workers who smoke is at 28 million, over 28 million. And additional missed work days per year due to poor health is 2.5. Additional missed work days per year due to smoke breaks is 9. Estimated annual incremental absenteeism costs are at 341 per missed day, so at $218.5 billion. The estimated annual incremental health care costs are at about $2,000 a year and $59 billion. Total estimated annual incremental costs, healthcare and absenteeism, is at $277.9 billion. And this comes from the Gallup Healthways Wellbeing Index. There's also possible additional costs for litigation, costs from non-smoking employees seeking compensation for diseases, lost productivity due to exposure in the workplace, discrimination lawsuits. Is somebody not on mute? Discrimination lawsuits from exposed non-smokers sensitive to tobacco smoke, in hundreds of cases with widely varying payouts in the US and other countries. So smoking also costs non-smokers too. A lot of people don't realize it, and even I didn't realize the impact until I did the research, but my healthcare costs are higher. My exposure to secondhand smoke costs me. Taxes going to federal programs to stop smoking, the healthcare cleanup and enforcement, environmental cleanup. The EPA estimates that 4.8 billion, and this was in 1994, so it's out of date, but that's in $7 billion or $7 billion in current dollars. So this cleanup goes to cleaning walls, replacing buildings that have smoke stain in them, repainting them, replacing flooring, furniture, and that type of costs. The U.S. HUD housing spends millions of dollars associated with smoking, $37.5 million a year on maintenance costs alone, and $4.7 million for fire insurance. And this graph right here kind of goes into more detail on the different costs that are attributed to smoking in HUD housing. So you can see them at a low year for just enforcement on a low year is $6 million, and on a high year it's $30 million. And I think what they estimated is for the first year enforcement, the highest being $30,000, and that going down after a few years. The HUD housing just passed a law to where there's no smoking in any HUD housing, and I think that was passed in December of 2016. Gambling with our health, smoke-free policy would not reduce tribal casino patronage. So this is a survey and study done by Isaiah Brokenleg and some of his partners. There was 957 people surveyed, and 54% of them were likely more to visit if there was a smoking policy, a no smoking policy, and only 18% of them were to visit left. This study, I believe, was done in casinos in Michigan. So they went around and surveyed each person, and I think what they had found is that their visitors would most likely go up if there was a smoking policy. So the tribal casino would likely realize increased patronage associated with smoke-free status while also contributing to improved health for casino workers and patrons. Why is it important to develop tobacco policies in tribal communities? Well, first of all, tobacco use is the leading cause of preventable death, and Native Americans lead the U.S. in smoking. The secondhand and third-hand smoke impacts on children are a lot higher in tribal communities, and this to me is really important because I do have children. What we can do here at GPT CHB is we can work with these tribes by helping to develop community partnerships, educational outreach, technical assistance, and trainings. And when we work with these tribes, we can help them determine their goals, develop a plan of action, implement the plan of action. We can go out and visit and help assist them with whatever they need, and then just letting us know what their progress is. This is the model that the Cheyenne River Sioux tribe used to reach their smoke-free reservation. What they did is they started out with building a coalition and collecting data. They did a lot of work to raise community awareness and educate not only the youth, but also the older tribal community and the tribal workers on the issues of smoking. They became familiar with their decision makers, their tribal council, and educated them on the non-smoking policies. And then they developed a policy. And I believe they developed quite a few different policies before they presented the policy that the tribal council approved. And now I know they do a really great job at enforcement, and they have a lot of community involvement in enforcing the non-smoking policy on the reservation. Some of the resources for implementing policy and resolution in a tribal settings. I know the State Department of Health has a lot of programs, the CDC, Indian Health Services, tribal health boards like Great Plains, and local coalitions. I think a lot of the resources are going to start at the local coalitions and then work up to working with everybody else in developing these policies. So if you really think about the costs that are nationwide for non-smoking policies, and you bring it to a tribal level. I could not find any studies on what the impacts were to any specific tribe. I don't think I know of any tribes that have done the research on it, but the health costs, the maintenance and housing, I know I've worked with some housing departments and different tribes, and they put a lot of money into replacing items that are covered in smoke. They've stopped using carpeting in their houses because of the smoke, and painting and using the kills stuff to kill the smoking that's in the walls, and also cleanup of litter. There's a lot of areas in front of tribal buildings where they aren't supposed to be smoking, full of cigarette butts and from just people gathering and smoking, and then also the burial costs from smoking related deaths. So if anybody has any questions, can open that up to questions.
Thank you, Tara. So like Tara mentioned, if anyone has any questions, please feel free to go ahead and chime in either through the chat box or through your speaker. I got a question. So Tara, you might have mentioned this, but was there any policies or anything that was being developed on third-hand smoke with your new findings?
With what kind of smoke?
Third-hand smoking?
Third-hand smoke? I have not found any research on third-hand smoking, and I've even when we were at CDC and talking to the folks there, they didn't really have a lot of information, and the state has a really good brochure that goes into it, but there isn't a lot of studies on the third-hand smoke. But I think it's interesting because it's something that a lot of people don't realize, and that's something that I compare it to is if you were in a house fire and part of your house got burnt, you're not cleared to go back in there to move in because of the smoke that's on the walls, on the shelves, on the clothing, curtains, everything. So I like to just compare it to that, because you don't want to expose yourself to smoke, and people don't realize just because they are no longer smoking in front of somebody doesn't mean that they're not putting them at risk for exposure to third-hand smoke.
Thank you, Tara. And also I want to thank Tara or Tasha Peltier and Charday on the suggestions that you've mentioned within the chat box. And we also have a question from Shania Turner-Smith. What are suggested initial first steps to implementing non-smoking policies in tribal communities?
I think the first step is kind of getting a group of tribal members or people in the community that are interested in implementing these policies and working together and figuring out where you want to go with the policies, where your needs are, where who has policies, what policies aren't being enforced, and how to move on from there. I think that is the first step. And anybody that's in the Great Plains region is more than welcome to email me, and I can help you with those first steps.
Thank you, Tara. So if there are no more questions, we do have a survey that is particular to this webinar. If you would please click the link in the chat box, and it'll pull up through SurveyMonkey and fill out the feedback form and let us know how our presentation was and give any suggestions. That would be great. If there are no more questions, I would like to thank everyone for joining us today. We do have community health webinars every month. The next one will be sent out soon as we figure out a time and day for that. But once again, thank you everyone for joining us today. And today's session is recorded, so if you do know anyone that would find this presentation of interest, you can go ahead and send the recorded session. I'll be sending that out shortly, as well as the survey feedback form. So thank you once again, everyone, for joining.
Yes, thank you guys.